So you are prescribed an antibiotic and you are curious if you should take a probiotic with it. So let's say you have an infection, something that absolutely warrants that you have to take this antibiotic. It's really a health concern at this point. So question that I hear often is, should I take a probiotic with my antibiotic? And I want to provide some context. I want to provide a little bit of summary of some research and some considerations if you are in this situation. So first and foremost, the state of your current microbiome is really one of the biggest determining factors. If you're not someone that's had to take an antibiotic in the recent, in recent history, and you have an otherwise healthy microbiome with no, GI issues, you're going to probably recover from that course of antibiotics a lot quicker. You're probably going to be at a little bit less risk of reduction in microbial diversity or colonizing other things like, C. diff or something that you might not want going on in there after the course of antibiotics is done. If you're someone that's had to, has had recurring infection, is having to take antibiotics often for whatever reason, or has a history of that, or already has pre-existing GI issues, well, that's going to change things a little bit, because for one, you're probably already lacking microbial diversity a bit. You probably already have some small intestine bacterial overgrowth or some dysbiosis or something going on there that's going to be even further disrupted by that course of antibiotics. So there is some research on this. Now, it's going to show us different things because, of course, each participant's going to be in probably a lot different situation, gastrointestinal wise, going into it. So it's kind of hard to have an accurate control of a study like that. But essentially what it shows us is we do see a reduction in microbial diversity with course of antibiotics, all of them, pretty much. Okay. So to varying degrees, to varying lengths, people recover at varying degrees of speed. What we see is that the microbiome in the mouth generally recovers pretty quickly. Gastrointestinal tract takes a lot longer. Certain antibiotics do seem to be a little bit more harsh than others. For example, like clindamycin has showed in some of the research that it can take like up to 4 months even to recover a normal microbial diversity and normal microbiome in the gastrointestinal tract. It's a pretty long time. So some other antibiotics, it was like a couple weeks. So, keep that in mind. It's not going to be cut and dry based on, depending on what antibiotic you take, but they're all going to cause some disruption in the diversity of your microbiome and the balance of those. And depending on the state that you're in going into it, that's really going to kind of dictate whether or not we should take additional precautions or not. And what is your diet like? Do you have plenty of diversity in the diet that's feeding commensal bacteria effectively, that's helping keep balance in the microbiome? Do you have enough fiber in your diet? I mean, what does that look like? So all these things are considerations when we're going into a course of antibiotics. If you are at a high risk and you are someone that perhaps needs to take a probiotic during your course of antibiotics, again, it's difficult to say exactly what strands you should take. You shouldn't just grab some random, probiotic off the shelf, but we should probably look for things like Saccharomyces boulardii or bifidobacteria, or even lactobacillus, certain lactobacillus bacteria strands. So perhaps something like this Therabiotic ABX support. There's others. This is just one example that contains the typical types of strands that you'd be looking for as more of a protection during that course. And then, of course, afterwards, we want to assess that condition. How do we feel? Or do we have a good diverse diet that's able to continue to feed microbiome effectively afterwards? That is huge when we're trying to recover from that. And when we're looking at physique, athletes too, how much food you're eating is even a factor. More food, depending on the composition, might lead to more fermentation. So, there's a lot of factors in there, but you really have to take all that into account and really make a decision as to whether or not you are a high-risk population going into that course of antibiotics, and that's going to kind of determine if you need additional support. So hopefully you guys don't have to take antibiotics, but I know it does happen every once in a while, and it's not always preventable. So those are some things to consider.